So there's many pipeline drugs that I'm particularly excited about. There are some oral drugs such as the STAT6 inhibitors, and there's both a STAT6 degrader from Kymera as well as a STAT6 inhibitor from Recludix that seem to be very promising, and I'm excited about. The ITK inhibitor soquelitinib, it's exciting. We also have a longer acting IL-13 in zumilokibart, whose data looks great, and I think that's an exciting molecule. For other mechanisms, the IL-18 and some of the bispecifics as well. So IL-18 blockade with IL-13 and IL-13, IL-4 TSLP or IL-4 receptor with TSLP, I think are also promising as well. One of the other molecules which is very novel is the IL-2 agonist, Rezpegaldesleukin. The fact that it can increase the brakes on the immune system, the Tregs, and treat atopic dermatitis is, again, also very exciting. So there's a lot to be really excited about in the pipeline. When people have hand involvement of their eczema, it really affects them. Hands are so critical, and when hands are involved, it's more than just itchy. It can be extremely painful and affect people in terms of their quality of life in a much more severe way than if other areas are affected. So we really need treatments. Plus, because we use our hands for touching things, they're exposed to more chemicals. It's oftentimes a mix beyond just atopic, but of other causes as well. There may be components of the irritant or allergic contact that make up chronic hand eczema. So it's really important that we have treatments that help. Because the skin is thicker in the hands also, it can be challenging for traditional topicals to help in those locations. So having new topicals, new orals, new biologics to help with chronic hand eczema is something that we need, and I'm optimistic we'll get more agents in the future that address that need. When I'm looking at clinical trial data, I try to look at it holistically. I'm not just looking for one endpoint, but I want to see consistency across multiple endpoints. I'm a big fan of the EASI score, particularly EASI 75 and EASI 90. Pruritus NRS is an important endpoint, as well as the FDA mandated endpoint of the IGA, 0 or 1. And I think it's really important to see a consistency across all of those results when we're analyzing data. So when I treat patients, I try to make sure that the care is individualized. I utilize shared decision-making for patients. And I often divide patients up into, are they topical responders or do they need a systemic? And sometimes those patients who need a systemic also need an add-on treatment with a topical. And I'm more than happy to do so. The topical is often used as a PRN basis. And usually we can, playing around with the different options, find something that will help patients, even those with fairly recalcitrant disease.